Lifting and transferring of patient. It is the easiest and most important things to know every nurses for to give comfort and safety to the patient while transferring from one patient to one place to another. Introduction. Lifting is a technique by which the patient is moved. It is also technique. Not you can not transfer the patient by any time anything like just unwantedly. Gently and safely based on scientific principles. There is also some principles to move the patient from one place to another. Definition. Transfer is defined as preparing patient, completing necessary records, and shifting the patient to another department within the hospital or another hospital/home. Transfer is defined as preparing patient. It is a transfer means you have to prepare patient, and by collecting all the data, all the records of the patient, and shifting the patient to another department or another ward of the same hospital, or you have to sometimes you have to transfer another hospital also, because if there is no facility which is required for the patient for the patient, you have to transfer from one hospital to another hospital also. Or if the patient is recovered, then there is also some principle how to transfer them to their home. If the patient is recovered, that means not we have to send any. How can they go? Transfer or referrals means same. Or next, transfer referral are the preparation of a patient and the referral records to shift the patient to other department within the hospital or to the another same thing. You have to keep all the records of the patient, and you have to give most comfort and most easy to the patient to move from one place to another place. Some of the general principles to move the patient from one place to another. First principle is position yourself. Before the transfer from one place to another, you have to maintain your position balance or your posture balance. If your position is good, then automatically the patient position is also good. Position yourself. Correct foot position is essential to maintain balance, because foot is the most balanced position of our body, and so foot position is most essential to maintain balance. Lift with leg muscle, because left leg muscles are much stronger than lower muscles. Lift with your legs, you can avoid strain. Strain means muscles injury. And it is also called pull muscle. It is very painful injury. It can avoid strain on back muscles, means back muscles tear, and lift, you can lift more weight also. Principle number 3, tuck your chin. Tuck your chin means chin tucks helps stretch your neck muscles, and they also helps maintain posture. You can do chin tucks while on your back, standing or sitting. The act of tucking the chin may reduce. How can you tuck the chin? It may reduce the spiral muscles to contact, so there is less chance of muscle strain. Means, how can you perform the tuck the chin? It may reduce the chance of muscle strain in the back. back muscle, if then it is difficult to transfer to patient or any other body. Use rocking movement. Rocking on objects builds momentum, which can aid the lifting process. Rocking the objects. If you move the patient through any objects, it is easy to transfer, which can aid the lifting processes. It may increase the lifting processes. Principle number 5. Hold the load close. If you hold the load as closer to as possible, you will cut on the stitches it extracted on your arms and back. If you hold the load close to as possible, if you hold the load as possible, you will cut on the stitches in extracted on your arms and back. Do not twist or bend. Moving your feet instead of your upper body. Moving your feet instead of your upper body can help you balance the load and minimize the strain in your back and abdomen. Before you move your chest or upper body, you can have moving your instead of moving your upper body, you can have to move your feet to balance the load and minimize the strain. Strain means and minimize the strain in your muscle injury in your back and abdominal muscle. To minimize the strain in your back and abdominal muscle. Purposes of moving and transfer of body. Purpose of the transfer of patient from one place to another, one hospital to another. To perform the task efficiently. Means if you are transferring the patient from one ward to another or one hospital to another, it not to give any effort to the patient. The to promote, if you are doing something work, then the works will be done good or something efficiently. And to avoid patient from unnecessary effort. Yeah, same thing. The nurses or health worker should not give any efforts or unnecessary effort to the patient while moving from one place to another. To prevent nurses from strain and back injury. Same thing. To prevent nurses from strain and back injuries. Strain means muscle injury or back injuries. If there is any illusion in transferring a patient from one place to another, it may occurs strain, or strain means muscle injury or back injuries. To promote comfort to the patient. Yeah. The main purpose is to transferring a patient from one place to another to give comfort to the patient. Lifting criteria. Position of weight. The weight of the objects to be lifted should be as close to the filter as possible. Position of the nurse, because the objects to be lifted in the same place as the nurse. The weight of the objects to be lifted should be as close to the filter as possible. Height of the body. The best for lifting an object vertical is slightly above the level of the middle finger of a person with the arm hanging off the side at the side. The best height for lifting an object vertically, slightly above the level of the middle finger. of a person with a arm hanging at the side. Maximum weight of the object should not be more than 35% of the nurse's body. If the weight is more than 35% of the nurse's body weight, then they are not unable or they are very difficult to transfer the patient from one place to another. So they have to remember that the patient is just 35% more than the nurse's weight. If there is more than 35% of the nurses, then they have to bring another steps or they have to do another task or another way to transfer the patient from one place to another. For body position, it varies with different lifting tasks. General instruction: some instructions should be to give the patient to transfer the patient. Plan the movement of a patient ahead of time and be sure the bath is clear. There should be a plan to movement of patient ahead of a time and be sure that the bath is clear. Flex the knees and hip joints but keep the tuck as vertical as possible. The they have to keep flex the knees and hip joints, but they have to keep the tuck. They have to tuck the chin. They have to tuck tuck the chin means they have to maintain the balance. So they have to maintain balance. So they have to keep vertically as much as possible. Assistance should be requested when lifting or moving heavy patient. If the patient is more than 35% of the nurse's weight, they have immediately called to the another staffs or assistants to carry heavy patient. If the height of the bed, sometimes it need to be adjusted. So some height should be adjusted to lifting the patient from one place to another. Before lifting the patient from one place to another, the nurses or the nurses should to watch the height of the bed. Otherwise, it is very difficult to the patient as well as to the nurse to transfer from one place to another. The patient is moved to the edge of the bed before he is lifted from the bed. If the patient is in the center, then it is very difficult for the nurses to transfer from bed to wheelchair or any stretcher. So they have to come edge of the they have to move edge of the bed. So it is easy for the nurses to transfer from one place to another. Unless contraindicated, encourage the patient to use his ability as much as possible. Unless contraindicated, encourage the patient to use his abilities as much as possible. Contraindicated should be given to the patient to use his as much as abilities of the patient as much as possible. Observe the patient for symptoms of orthostatic hypotension such as fainting, dizziness, sweating, etc. Orthostatic hypotension means defined as decreasing in systolic pressure or in decreasing BP or 20 mmHg or a decrease in diastolic blood pressure of 10 mmHg within 3 minutes of standing when compared with blood pressure from the sitting or supine position. Such as fainting, dizziness. Fainting means unconscious, like sweating. The most responsibility to give care, to give comfort to the patient is nurse. There is more responsibility to give comfort is for nurse. Nurses responsibility in lifting and moving. Evaluate the situations. Nurses have to evaluate the situation of the patient. Explain to the patient exactly what is. Nurses have to define all the procedures, all the medication which is given to them, which is given to the patient, and what they are going to do. They have to know all the medications and all the procedures of their. Provide equipment which may help the patient assist in love. They have to provide proper equipment which is required for patient. Example, bladder. Adjust a stretcher, chair, etc. to the bed level. The position of the stretcher chair should be maintained at the level of the bed, or vice versa, and lower and hand drill on side road. To because if the position of the bed is, if the position of chair or stretcher is little bit up from the bed level, then it is very difficult to transfer the patient, or it is very difficult to leave the patient, or to keep the in the bed, or the stretcher or wheelchair. Hold the patient close. This will help your balance stand on your arms and back. Hold the if the patient is patient, then it helps to maintain balance, and balance, and it helps from stand. It helps to avoid stand back muscle injuries on arms and back. Keep your feet apart. This will provide a stable base. The nurses have to keep their feet little bit apart. This will provide a stable. This provide a balanced base. Use gentle rocking movements to assist the initial movement of the patient. There should be a gentle rocking movements to assist the initial movement of the patient. When working with others, make sure everyone knows what to do in advance and move it. If you have to consult, the nurses have to consult everybody which are going to that same task. If they doesn't know, then there may be some illusion or some errors, and that is very dangerous for the patient, and that cannot be afforded. So they have maintained to know everything, and they have to leave the patient at the same time. They have to move at the same time. They have to know every procedures and every things in advance. Preliminary assessment check. The nurses have to follow the every precautions which is given by the doctors. General condition and diagnosis of the patient. The conditions of the patient and diagnosis of the patient should be checked by the nurse. Level of consciousness. The nurses have to check the level of consciousness. If they are they are full consciousness, or half consciousness, or no consciousness, they have to check the level of consciousness of the patient. Self-care ability. If the patient is able to care by self, or does not require nurses for their personal purposes, like moving to bathroom and any purposes they can move. Presence of tubes and lines, example intravenous line, follows catheter, etc. Mental stable to follow instruction. The nurses should maintain calm to follow instruction of the doctors and any senior nurse or superintendent nurse. Number of personnel required to move the patient safely. They have to know how much personnel is required to move the patient safely. If the patient is more than the 35% of the nurse weight, then they have to immediately refer to the another nurses or another staff to leave the patient or transport the patient. Articles available in the patient unit, examples stretcher, IV poles, clamps for disconnecting tubes. The staff required for articles available in the patient unit, they have to disconnect tubes, stretcher, IV poles, clamps for disconnecting tubes. Preparation of the patient and environment. The patient should be the patient should be know everything which is going to be done for them. They should be familiar to the environment of their ward and of their precautions. Explain the sequence of the procedure. They have to know every detail procedure to the patient by serially or sequentially. They have to provide privacy because sometimes patient cannot say all the things to their family members and all of that and doctor as well as they can only say to the nurses. So nurses have to keep privacy and they are only able to tell the things to doctors. Adjust bedpan, urinary if needed. They have to adjust bedpan, urinary if needed only. All the articles which is required for the patient is available at the bedside, because if it is in emergency then they have not to move from one place to another place. So it is provide privacy, it is provide comfort, it is provide easy to the patient. So all the articles will be at the bedside. Remove all comfort device used for the patient. Clamp the catheter to prevent backflow of urine during the transfer. Clamp the catheter to prevent backflow of urine during the transfer. Catheter means the thin tube which helps to backflow of urine during the transfer. Clamp the nasogastric tube and other tube if any. Nasogastric tube is a flexible tube of rubber or plastic that is passed through a nose, down through the esophagus and into the stomach. It can be used to either remove substances from or add them to the stomach. Place the foot stool if needed. If it is required, then they have to keep footstool to maintain balance or to give comfort to the patient. Encourage the patient as if possible. If the patient is encouraged well and they are able to move or they are something how they can do by themselves, then that is the big sign of patient is recovering or they are being well. So that encourage the patient assist if possible. If they cannot move and they cannot even shake the body also, then they are not, the nurses or doctor should not be give encourage or should not give any force to do. But if they are ready or they are assist, they are encourage the patient. If they are ready, then they have to give encourage. Some of the devices that is used for the in hospital or any health sectors to transport the patient from one ward to another, or one department to another, or one hospital to another hospital. Stretcher, ambulance, wheelchair, or bed, that wheelbed. You can move from this bed from one ward to another ward also. Wheelchair, everybody know. Stretcher, ambulance. Procedure: moving the patient in bed to side. First of all, wash hand and dry it. First and important thing, the hands should be clean and dry, because if it is wet, then it may be irritation for the patient, and it so patient they have to give knowledge. Wash hand and dry it. Place the bed in flat position. Bed not should be in vertical or horizontal position. They have to be in flat position. Place the patient in supine position. Patient have to be in a supine position. They are not able to, if they are not able to walk, then they have not to be in horizontal or vertical position. They have to be in supine position. The nurses place their arms on bed, sliding them under the patient head, shoulder, lips, and leg. If the patient is unable to walk or unable to balance their body, then the patient should their arms bed sliding their under the patient head, shoulder, lips, and leg. Wait for the leader signals by counting 1 to 3. When the leader counts 3, move the patient to side of the bed using a right angle pull maneuver. Anybody cannot move the patient by themselves. There is some leader which counting the 1 to 3. When the leader counts 3, then the patient is to keep the side using a right angle, means 90-degree angle pull maneuver. Assisting the patient to sit on the side of the bed. Turn gently to the right side of the patient. Assisting the patient to sit on the bed. Place the patient in a supine position. Same thing. Flex the knee gently, left leg only. The nurses have to flex the knee gently, not the harshly, softly. They have to flex the knee, but only left leg only, not the right leg, only left leg. Support one hand at the shoulder. The nurses have to keep one hand to the shoulders and other in the hip to maintain balance. Turn gently to the right side of the patient. So if you are going to be patient gently to the right side, then you have to give the left leg. Access the patient to the side heels of the edge of the mattress. Access the patient to side heels of the edge of the mattress. The patient to side heels of the edge of the mattress. Then roll upward on elbow till his ear reaches a single position. Assist the patient to place both arms extended backward with the palms supporting on the mattress and both feet flat on floor to maintain sitting position. Shifting the patient from bed to stretcher. Position the stretcher at right angle to head or foot up. The position of the stretcher is a right angle, means 90 degree to head or foot of the bed. Cell helpers and position them at the beside. Cell helpers and position them at beside. Move the patient to the edge of the bed. To move the patient, to leave the patient, so first of all the patient is moved at the edge of the bed. To easy for the nurses or easy for the patient as well as. At the count of 1, the nurses slide their arms under the patient to support the section of the patient. At the count of 1, the nurses slide their arms under the patient support to section of the patient. At the count of 2, the nurses stand with the back erect, holding the patient near to their body as possible. At the count of 2, the nurse stand with the back erect, holding the patient near to the body as possible. On the count of 3, the nurses take one step backward, pivot on their heels towards the stretcher. Pivot means change the direction on their heels towards the stretcher. 7. At the count of 4, move to the side to the stretcher and stand with a wide base and fixed knees, ready to lower the patient into the stretcher. At the count of 4, move to the side of the stretcher. The patient is moved to the stretcher and stand with the wide base and fixed knees, ready to lower the patient into stretcher. Then the patient is ready to lower the patient and into a stretcher. At the count of 5, the nurses lower the patient to the stretcher in a back-lying position. At the count of 5, the nurses lower the position of the patient in a back-lying position. 3. Assisting the patient from bed to chair or wheelchair. Place the wheelchair or armchair at the right side of the bed. Place the wheelchair or armchair at the right side of the bed, not to be left side, right side of the bed. Wheels will be locked, because if it is not locked, then there is chance to move unwantedly. So they have to check it is either locked or not locked before the patient is ready to do transfer. Help the patient to sit on the chair. The nurses have to help the patient to sit in the chair. Tell the patient to slide his buttocks to the edge of the bed by shifting his weight alternately from left to right side of the left buttocks till his feet placed on the floor in a forward backward wide base position. The nurses help to tell the patient to maintain their buttocks, left buttocks or right buttocks to slide till his feet placed on the floor. They have to slide their buttocks until the foot placed on the floor in a forward backward wide position. One foot placed at the back for the other slightly under the bed. One foot placed at the back of the other. One foot should be placed back of the other foot slightly under the bed. It is slightly under. It should be slightly under the bed. Tell the patient to stand on command by simultaneously leaning forward. After the command of the nurse, patient have to stand simultaneously, smoothly, leaning forward, pushing with the foot placed at the back as a strains his legs. They have to keep foot back and stands its legs. The patient stands upright by balancing himself at the armchair, side rails or mattress. The patient stands upright by balance himself. Means the patient should stand upright by balancing himself on the armchair, side rails or mattress. Tell the patient to place his left arm on the firm arm of the chair or wheelchair and pivot on the heel of his feet and bringing the buttocks towards the wheelchair. Observe the correct sitting posture. Reserve the procedure to return the patient from wheelchair to the bed. Observe for correct sitting posture. The nurses have to check the posture of the patient. They need to be the patient should be in the correct sitting posture. Reserve the procedure to return the patient from wheelchair to the bed. Aftercare. Make sure that the patient is in a correct alignment is comfortable. Make sure the patient is a correct alignment is comfortable, which is provided for the patient it is comfortable or not. Replace the pillows and other comfort devices are needed. The patient should be provided comfort devices which is required for them. The nurses should remain within the patient in front of him when the patient assumes a sitting or standing position. The nurses should be remain in the patient in front of him when the patient assumes a sitting or standing position. While the patient is moving from one place to another, the nurses should be with them in front of them, because sometimes they may lose their balance and they may fall down, so they have to in front of them. Tidy of the unit. The units, the ward or any department should be clean so that the cross infection or any things not to be held in the hospital area. Wash and thoroughly. The patient hands should be washed timely or thoroughly. Record the procedure in a nurse's record. The procedure which is given to the patient is should be maintained in the nurse's record book to give the record to the seniors or the physicians or doctors. Log rolling. Log rolling is a technique used to turn patient whose body must at all times be kept in straight alignment like a log. Log rolling means a technique which used to turn patient, means turn the patient body must at all the times it is a straight alignment like a log. The technique is for the patient who has a spinal injury. It is a technique. It is a technique used for the patient with spinal injury. If it is the injury in the spinal, then the patient cannot move or cannot bend from left side to right side or right side to back side or another thing. So it is log rolling is for that technique, for that purposes. Log rolling requires 2 people, or if the patient is large, 3 people. For the log rolling there is required at least 2 people, and if the weight of the patient is more than 35% of the nurse's weight, then it is required 3% or 4%. Some of the figures is shown in the log rolling. You can see it in some pictures there will require only 3 people, and in some poster there is required 4 people. Technique. First and foremost, wash your hand. Approach and identify the patient by checking the identification band and explain. approach and identify the first of all they have to identify the patient by checking the identification band and explain the of the procedure. Provide privacy. Privacy is the most basic needs of most should be given best facility uh, should be given to the patient. Privacy. Position of bed. Position of bed is also the technique of the log line. Position yourself with your feet apart and your nose inward close to the side of the bed. First and foremost, the nurses should give their position them and feet apart and your knees interclose to the side of the bed. The knees should enter the side of the bed. Hold the patient arm across his chest. The patient should be fold across his chest. Place your arms under the patient so that the major portion of the patient weight is sent. The patient the arms should be patient. The arms should be under the patient so that the major portion of the weight it is concentrated between the arms. The arms of one nurse should support the patient hand and neck. Raise the side roll on the side of the bed. Move to other side of the bed. Place a pillow under the patient head and another between his leg. One pillow under the patient head and one pillow under his leg. Position the patient near arm towards him. Patient should be near position near arm towards the nurse. On the count of 3, roll the patient to a lateral position, rocking backward onto your heels. Transferring patient from bed to wheelchair. Purposes: enhance the well-being of patient. To give the oil or to give the comfort to the patient. To transfer the other department for investigation like X-ray, ultrasonography, electrophalography, etc. To transfer to other department for investigation like X-ray, ultrasonography, electrophalography. Electrophalography means the electrical activity of the brain. Ultrasonography means the monitoring the ultrasound pulses to delineate objects or areas of different density in the body. Electrophalography means it is monitoring the electrical activity of the brain. Improve self-image and ability to move around. Improve self-image and ability to move around. Procedure: explain the purpose of use of wheelchair. First of all, the nurses have to tell the patient to the purposes of use of wheelchair. Access the patient ability to move. Patient have to train to how to move the wheelchair. Place the wheelchair at the right of the patient and lock it. Always the wheelchair should be kept at the right side of the patient and it should be locked. Raise the bed to the level of the wheelchair. The bed should be between level of the wheelchair. Otherwise, it disbalance the body of the patient. Elevate the head end of the bed, slide down the chairs. Provide privacy. Take assistance from males, females, or lines. First and foremost, the patient should provide privacy, and there should be provide assistance. Take assistance to move the patient. For males, it should be require males and females or lines. Have the patient to stand in front of the wheelchair. For the nurses or other health workers should be stand in front of the wheelchairs to help the patient. Lift up footrest and assist to sit on the chair. In case of chronic hemiplegic means is a condition caused by your brain damage or spinal cord injury that leads to paralysis on side of the body. One nurse stands behind the patient, slides hands on the axillary and holds the chest level. One nurse or a line stand in front of the patient, holds his leg and simultaneously lift the patient to the wheelchair by counting or 1, 2, 3. How to move from bed to stretcher or stretcher to wheelchair. Sorry. Transfer from wheelchair to bed. Patients who are weak, very ill and with fracture of legs and transfer from outpatient department to the one by wheelchair. Patient who are very weak, very ill and they are fractured legs, they have to move transfer from wheelchair to bed. Procedure: explain the technique of sliding from the wheelchair to the bed if the patient is able to move by himself. Keep the wheelchair with the middle close to the bed and lock the wheelchair. Keep the ask for the MNO/FNO assistance. One has to be at the back side and one in the front of the patient, lifting the patient knees and thigh up. Nurses should count 1, 2, 3. Then both simultaneously relieve the patient from the wheelchair onto middle of the bed. Slowly help the patient to the lie down by giving support to the head and back and place the legs. Slowly the patient to lie down by giving support to the head, back and place the legs on bed. Place the patient in correct position. The patient should be in the correct body alignment and make comfortable by giving extra pillows. The patient should give the extra pillow to make their body stable and maintain balance. There should be a 45 degree giving the patient from wheelchair to bed. You can see in the image also. Transfer from bed to stretcher or stretcher to bed. Patient with spinal injury. If there is a spinal injury, then they are not supposed to sit in the wheelchair. They have to give stretcher and stretcher to bed. And patient after the surgery, they have to keep in the stretcher or stretcher to bed. Patient with a CBA and unconsciousness. If there is no consciousness, then people with CBA and unconsciousness, they have to separate to bed to stretcher or stretcher to bed. Patient with a multiple injuries problem. If there is a multiple injury problem, then they have to move to the bed, stretcher to bed. Procedure: check the doctor order. Foremost, the every nurse have to follow the instruction or precaution of the doctor order. Keep the stretcher ready with the necessary articles. Stretcher should be ready at any time with necessary articles. Explain the procedure and purpose. Every procedure and purposes should be mentioned to the patient before the medication to the patient. Provide privacy. Privacy should be provided to the patient. Loosen the draw seat on the both sides of the bed. There should be loose the draw seat on the both sides of the bed. If there is a roller, keep it under the backs of the patient and roll into the stretcher on count 1 to 3. Take care of the head. Place the arm across his chest. If the roll, keep it in the back of the patient and roll into the stretcher on the count of 1 to 3. Then there should be chance of the so care of the head place. So there should be care of the head. Arm across chest. If the roller is not available, middle person hold the drum Macintosh. If there is not available of the roller, then the middle person hold the Dom Macintosh, one hold the head and another hold the legs, and leave the person from bed to, because the weight is spent to the all directions, so that the three persons, one person have to hold the middle Dom Macintosh, and one person hold to the head and chest, and one help to help hold leg. Remove the roller side of the side rails of the stitcher. You can see is there in the image also. Conclusion: proper lifting technique. There should be, in conclusion we can say that if there is no technique, the technique is highly required for efficiently of the work. So proper, there should be if the if the patient is transferring from anywhere, then there is a technique is required, proper lifting technique. The nurse should be no proper lifting technique. Preparing an individual for a move. Everybody have to prepare for the movement, for a move. Lifting and moving techniques. There should be lifting and moving techniques should be know everybody. All in all, just remember to be asked for help when needed to the patient. Every should be asked to just remember to ask for help when needed. If the patient is required the help, then the nurse should be asked to remember. The nurse have to ask to remember the patient if if is required or not. Stay home, stay safe. Thank you for cooperating with me. Thank you.